In December 2012, as I was appointed Chairman of Oversight and Investigation. Congressman Ellmers was appointed to the subcommittee too. We were tasked immediately by leadership because it was right then that the shootings at Sandy Hook occurred, on top of all the other things that had occurred, whether it's Aurora, Colorado, or Tucson, or just pick a city, pick a name, and it just continues on. And so this was get to the bottom of this. What can Congress do? The Senate moved quickly, as you may recall, on talking about the size and the number of bullets in a magazine and the description of a weapon. And we looked at not what's in their hands, but what's in their minds, what's in their hearts, what drives people towards us. And so we had a series of hearings and forums in Congress. We brought in parents, providers, and patients. We heard from thousands of people who contacted our office. I'm sure you had a ton contacting yours too. And this was not any preconceived thing in terms of what we're going to go after and changing America's mental health system. What we repeatedly heard is, it is broken, and here's some ideas to fix it. Then from that, we introduced this Helping Families in Mental Health Crisis Act, H.R. 3717, at the first anniversary of Sandy Hook, with the reforms in. And I should say that even meeting with the parents from Connecticut, they had said, they also said, this is a mental health issue. Please focus on that. My own area in Pennsylvania, we had a number of these. We had a shooting at Western Psychiatric Hospital. We had a shooter who went into an LA fitness center. And a constituent of mine went through and picked off people of different races and went to the synagogues and there. We had a kid at a high school, Franklin Regional High School, stabbed a bunch of students. And I sat down with some of these families right after some of their family members were killed, as they were being told, your sister's dead. That eats at you too. And you just reach a point where you're saying, I'm not going to sit back anymore. I recognize in America that we have a lot of people with no voice. These are the family members. I recognize also American Psychological Association, American Psychiatric Association, they're verbally supportive. They say, no, we don't want to make decisions here. And I have to bite my own lip and say, I can't take your indecisiveness. We have to do something. And I think my full turning point, my full commitment is when I had the parents of the children who were killed at Sandy Hook sitting in my office. I still have their pictures on the table in my office. I see them every day. And my promise was to fix this. And that's where I am. And Congressman Ellmers has been a champion for this too. The people on this subcommittee of Oversight and Investigation, it is safe to say that they know more about this problem than any other group in America is in Congress, because of the dedication that the committee members have put into this. And I think the same passion is with her. You just can't turn away from it.
No.
It is there, and people say, why do you put up these barriers? Why don't you let us get better? Why do you act like family members can't be part of it? I mean, what was the turning point for you?
As you point out, really, there are probably three. One, some of the terrible, violent acts that have taken place, knowing full well that, and most of the time, the issue that comes to the forefront is that, this is about guns, and this should, we should have stronger gun restrictions. Well, no, these are individuals that were showing signs and symptoms well ahead of time of severe mental illness. That's where the problem is. And knowing that certainly as a nurse, but those are some of the current events that have taken place. But then also in my time here serving in North Carolina, I've gone to many of our hospitals and gone to the emergency rooms, and knowing the number of mental health beds that have been decreased here in North Carolina, in 1992 we had 2,800, we now have 866. So what happens as a result of that, our emergency rooms have had to adapt space to keep those patients who are in crisis, who are in a mental health crisis, helped, sometimes waiting 3, 4, 5 days to get a bed that will be available to them. That's 5 days without care. And although those healthcare professionals are doing the best job that they possibly can, they're not psychiatric nurses and doctors. They're doing the best job they can. And what I saw and how difficult it was for them, and the situation that they're in as a result of that, that is a huge issue for for those hospitals and hospital room emergency rooms to have to deal with. But then also it's about the families. Speaking with family members and listening to many of the testimonies that we've had, the personal discussions that family members, parents of adult children have said, I've had to lie and say that my child threatened my life in order for me to get them treatment. And the guilt that they feel over time, and knowing that there are many times they feel the sense that I can't help my own child because my child won't acknowledge that they have a problem, and yet I know they do, and I'm afraid for them. So, you know, you take all of those things and put it together, and it certainly will bring you to a point of passionate reform. Yeah. And I do believe strongly that certainly this is such a good step in the right direction for mental health reform in this country, but then for North Carolina especially.
You know, and those groups who say we're going to stop this bill because we don't want to have our funding cut, that's their bottom line. And I'm saying, if you are in the space of using your money to help advocate for better patient care, go for it. I'm all for you. Make sure those things happen. If you're in the space of using your federal dollars to lobby for or against bills, or specifically to go and stop a patient from getting treatment because you don't agree with psychiatrists or psychologists and you're not a psychiatrist, then I'm going to say, yeah, I'm pulling the plug on you. Well, I'm asking for your help. I mean, I'm not beyond begging this bill, mainly because it's just too brutal what's going on out there, and your newspaper has already shined a bright light on this, and I hope you continue to do that. Thank you.